I think when you're thinking about the impact of sleep on health, you're kind of thinking about short-term consequences and then long-term implications as well. The short-term implications of sleep on health are pretty clear, and we've all felt them after a good or bad night's sleep. You know, the quality and quantity of sleep we get affects our emotional regulation, how we relate to others, mood, productivity, memory, these kind of cognitive functions, brain fog, just energy levels, sleepiness, and of course, road traffic safety. So that's all very well described, and we all feel those all the time. I think over the last few years, there's been a lot more media focus about the long-term complications of sleep health through books like Matthew Walker's Why We Sleep and other things. And on the one hand, that's really positive because it's raising awareness. And, I think it is drawing attention to what I think is probably pretty good evidence of long-term consequences of poor sleep, things like cardiovascular disease or types of dementias. But on the other hand, I think people should be aware that the quality of evidence we have isn't fantastic, and these conclusions are more associative rather than causative. So it's not a direct line of not sleeping enough, developing cardiovascular disease or dementia in the future. These are, I suppose, signals that we should be aware of, but maybe not get too anxious about, which of course is then counterproductive for our sleep quality. So I think, sleep is absolutely an indicator of health and has an impact on health. But I guess the message to put out to people would be to try and ensure that they consistently get enough sleep, or the amount of sleep that's right for them, that has them feeling well during the day.